All right, and we are live. Welcome to another edition of our physical therapy webinar, our weekly webinar. Today's topic is tendinitis. Lots of questions we want to answer for all our viewers. Of course, we are Premier Physical Therapy. Little bit about our clinic if you never heard about us or have never seen us before. We're located in two areas, one Jacksonville Beach and the other is Ponte Vedra. We have some specialties in mainly orthopedics. We have jaw and facial pain specialists, lymphedema specialists, and also running and golf programs. And I, of course, myself, my name is Curtis Pachoka. I'm one of the physical therapists here at Premier Physical Therapy. I graduated with my doctorate in physical therapy in 2015 from UNF. And I have been mainly practicing in outpatient orthopedics, and I've recently been board certified in orthopedics as of this year, as of July of 2020. So a lot of people have tendinitis, but we want to kind of clear some things up because you could have what's called tendinopathy. So I know it's pretty confusing, but we want to try to separate what is tendinitis and what is tendinopathy. So, but first, the question is, what is a tendon itself? Well, everyone really knows what bones are, and a lot of people know what muscles are. So a tendon attaches a bone to a muscle. So it's a connective tissue. It's made of collagen and fibrous connective tissue. It's capable of withstanding tension in the line of pull. Tension in the line of pull, meaning if you look at this picture here, this is your biceps tendon. This is the bone it attaches to, your radius bone. And what it's going to do is it's going to pull this bone up when the muscle contracts in the line of force or the line of pull. So that's its function, transmits force that the muscle exerts, which results in movements of the bone. All right, some of the most common areas some of the most common tendons that are affected by this tendinopathy or tendinitis are, of course, you have your rotator cuff tendons, you have your elbow tendon, which we call lateral epicondylitis, and some other ones are Achilles tendinitis down by your heel. You have patella tendinitis in your knee. Another one that I didn't mention is also hip. You can get tendinitis or tendinopathy in your hip. So how does injury occur? Most often it's due to overuse. It occurs in the tendons by loading them too much. So what that happens is it results in a decreased exercise tolerance of the tendon and a reduction in function. It's all about what your tissue is able to tolerate. If you have a breakdown in your tissue, you're not going to be able to tolerate the certain activities such as running, jumping, mainly repetitive activities, typing, gripping, things like that. So repetitive energy storage and release and excessive compression appear to be the key factors in the onset of tendinopathy. It's related to volume, how many hours, and frequency, how many sessions per day or per week. So if you had a recent increase in the number of hours you're doing a certain activity like running and the number of days you are running, that is a recipe for tendinitis. If you started playing tennis and you're playing 3 times a week and you never played before, that's also a recipe for tendinitis. Things like that. You start a new job, very manual labor intensive, like cooking. and you've never cooked all day before and now you're chopping all day, that's a recipe for tendonitis or tendinopathy, tendon injuries in general. So here's the question: is it tendonitis or tendinosis or tendinopathy? So in the past, most commonly, this was thought to be an inflammatory condition, and we're going to talk about this a little bit in the upcoming slides. But they would treat it like they would treat inflammation with anti-inflammatory medication, ice packs, cortisone shots. But now recent studies are showing that it's not necessarily true. Uh, so what was once called tendonitis is more often actually a tendinopathy. And so the microscopic examination of the tendon reveals that there's an absence of inflammatory cells. So there's not really this inflammatory condition, but a proliferation response of the cell and matrix, indicating that inflammation is not a major cause of the dysfunction of the tendon, but more so a failed healing response. So we're going to really focus on not inflammation, but more a failed healing response is kind of our line of thought of how to treat this condition. So more about this tendinosis or this failed healing response is characterized by haphazard proliferation of tenocytes responsible for changing structure in the matrix and collagen within the tendon in response to demand, degeneration of the tendon, neurovascularization, formation of blood vessels that normally shouldn't be there. And when you move these bloods, going to cause excessive pain and non-collagenous matrix, fatty infiltration of the muscle in the tendon. It's not supposed to be there. So when you try to use it, it's not going to function as well. So basically, anytime you have an injury, this is a different type of injury than a normal injury. Usually, an injury you're thinking of, maybe you fell, you scraped your arm up and you're bleeding. You have a series of events that lead to healing of that tissue. So first, the blood has to clot. You have the cells that go in there, clean out any debris. Then it starts laying down the tissue to build up your skin again. And then finally, you get some scar tissue. So when you injure a tendon with overuse, there's now this problem if there isn't this inflammatory response and there's actually a failed healing response. You have this damage to your tendon, almost like if you compare your tendon to a house and a hurricane comes in and damages your house. Some of the ceiling tile or the roof shingles are missing, broken windows, maybe some flooding. Uh, you don't want to start repairing that house right away. You first have to clean out some of the debris that's left in the house before you start, repairing the house to live in it again. So if you're living in a house that still has all this debris and stuff like that, it's just not going to function as well. So that's kind of what we're comparing it to. You've this failed healing, lack of inflammation, that's actually the problem. People of different ages with tendons under diverse loads present with varying degrees of pain, irritability, and capacity to function. Everybody's different is what this slide is saying. It depends, it goes back to your tissue tolerance. You could be 80 years old, but in fantastic shape. You work out every day. Your tissue can probably tolerate more than a 50-year-old who maybe is not in the best shape. Their tissue is not used to those loads, and most likely they can get more of an overuse kind of tendon injury. So who is at risk? We talked about this a little bit earlier. It's overuse. It's sports or activities with repetitive movements. So you want to think of sports, you want to think of occupational activities. Things that can make this worse are environmental conditions. Say you're working on the job, but it's humid, you're working outdoors, your hands are sweaty, and you're trying to use a hammer, you're going to have to grip even harder on that hammer because of the sweat, that you're going to overuse your tendons and get some tendonitis. Poor body mechanics. If you're not in the right alignment while you're doing an activity, you can overload those tendons and cause damage. So poor body mechanics, misalignments, fall in that same category. Leg length discrepancy, one leg longer than the other, that could lead to some overuse on one side or the other. Muscle weakness, like we talked about earlier, if your tissue isn't able to tolerate an activity, if you're too weak for that activity, you can get some tendonitis. Obesity and falls in that same category. You're not used to doing that certain activity, so your tissue probably won't tolerate it. And decreased flexibility. If you're tight in a tissue, the opposite muscle will have to work harder to move that joint. So you definitely want to take a look at your flexibility also. So a burst of unaccustomed physical activity or direct blow causes some microtrauma to the tendon, leading to thickening and weakening of the collagen fibers, cross-link, and disruption to other normal structures of the tendon slash matrix. This results in a weaker tendon, is more vulnerable to recurrent injury. This is what we talked about earlier. You're not having that healing response, the failed healing response, so it's not healing correctly, which because it decreases the function of that structure. So a reactive response, that is a short-term adaptation to overload that thickens the tendon, reduces stress, and decreases stiffness. So like we talked about earlier, it's a failed healing response. It's not healing right, and then it's not able to function. The good news, the tendon has a potential to revert to normal if the overload is sufficiently reduced, or if there is sufficient time between loading sessions in the acute phase. So we're going to allude to this next couple of slides. It's going to really fall on education of understanding your injury, knowing how to manage and stop what caused your injury in the first place, and then you want to build up that tissue to prevent it from getting injured again in the future. So how do we assess this condition? It's a little bit difficult. Most commonly, people will find out they have tendonitis through an MRI. But what we can also do is palpate your tissue. If you're tender on a tendon, you might have some tendonitis, tendinopathy, or tendon damage. What we do physically in therapy is we look at range of motion and flexibility, which could be associated with higher rates of tendinopathy. So we can kind of put 2 to 2 together. X-rays don't normally rule in a tendon issue. They don't look at soft tissue, but they can rule out any sort of stress fracture or any underlying bony abnormalities. MRI is, like I said earlier, that's what we usually see people come in here with when they're diagnosed with tendinopathy, tendinitis. Ultrasounds can be used too, but particularly they're really good at full and partial tears of a tendon, but they also can be used for a tendinopathy. How do we fix it? Traditionally, the approach has not been effective. Like I alluded to earlier, it was thought of to be an inflammatory condition, hence the itis. Itis means inflammation. But we're seeing that most of it isn't itis. It's not tendonitis. It's more tendinopathy or lack of healing response. So it's almost doing the opposite. If you're taking anti-inflammatory medications, injections that have anti-inflammatory properties like cortisone, corticosteroid injections, it's stopping inflammation that's not even there. So we actually would probably benefit more if there was inflammation. And so we're treating this, it's almost ironic, we're treating a condition that probably needs inflammation and we're giving it anti-inflammatories. So it's really encouraging a failed healing response. But if it was truly tendonitis, this would be effective. But like we talked about earlier, it's hard to distinguish what is tendonitis, what is tendinopathy. So our approach, we load it, which we'll talk about some upcoming slides. So the principles for rehab is rest it. We want to manage your injury. If you got your injury, for example, playing tennis, and you're doing tennis 3 times a week, an hour a day, we would probably have to reduce that so your tissue can tolerate it. So rest doesn't mean you don't do anything. What we mean by rest is we're going to modify your lifestyle activity so we can allow that injury to a chance to recover. Uh, Icing is good. Definitely a big fan of ice. You can ice for 10 minutes at a time. You can freeze a cup with ice in it, and you can ice massage your tendons. And then here, exercise rests involves limiting painful motion. Exercise adds motions and that strengthen the tendon. So exercise is still important in the resting phase, but it's all going to be modification and management. All right, so here's some information about some treatments. So the anatomy slide earlier showed the muscle, the tendon, the bone. So when we are trying to treat your tendon, we're looking to progressively load resistance in phases. Um, Also, we do a good bit of manual therapy. But also we can use exercise for the same in a low intensity type exercises can actually have a pain relieving effect. We call it hypoalgesia. And so it can kind of get rid of your pain while gearing towards this loading phase that we're about to introduce to your tendon. Eccentrics, we're going to talk about a little bit later, are really effective way to load your tendon. And I'll talk about that in a little bit. Okay, so here's the treatment phases I was telling you about. We always want to warm up the tissue, get the sweat going. If you notice, if you ever watch your players are always wearing jackets, long shorts, and then they take them off before they go in the game. This is so they keep their tissue warm. It makes the tissue more when it's heated, it's more flexible. One in our rehabilitation process is we want to do unresisted exercises, very light exercises to healing. As your pain goes down and you start to show signs of recovery, we start to introduce some light to moderate controlled stress for progressive resistance training, which is progressive loads with longer lever arms for progressive resistance training. So when you think of exercises, you can break them down, and you have isometric, which is you're contracting your muscle, but it's not going anywhere. You have concentric, which is actually curling the bicep curl on the way up. And then you have eccentric, which is lowering the weight down. And what we want to really focus on is very slow loading of slow concentric on the way up, slow loading on the way down is very good for loading that tendon. So some other forms of treatment, we have manual therapy, some fancy words here. We want to stimulate mechanoreceptors and proprioceptors that provide short-term pain relief. Basically, when we rub, when we do massage, when we do cupping, when we do any of our hands-on stretching, that's going to provide some pain relief. But the opposite muscle that's making it harder for the injured muscle to move. So you've antagonist muscles, which is the opposite muscle group. For example, if I'm working the biceps, the opposite muscle is the triceps. So if I have biceps tendonitis or tendinopathy, I might want to make sure my triceps is flexible and stretch that. Soft tissue, deep friction massage. I was talking about earlier. This is lack of inflammation, a failed healing response. So when we do a deep friction massage to your tendon, we're stimulating just a little bit of inflammation to kind of encourage not a failed healing response, but kind of reintroduce a new successful healing response, which can be painful, but in the long run, it might lead you to some pain relief and reduction in your symptoms. So, patient understanding, we do a lot of patient education here at Premier Physical Therapy, because if you do not know what's making your activities worse or how to modify them, then we will never get your injury better. If the source of the injury is still there, if you keep on injuring it, whether it's bad, a form during tennis or golf, or you're not in the best posture while you're working and typing at work, or if you're gripping a hammer too hard while working, we want to modify, find out what caused this injury, and then work to addressing and getting you some positive outcomes into the right direction. So, dry needling is a new thing that's starting in Florida. There's a picture of it here. There's little acupuncture type needles that can go insert into a muscle and relieve the trigger point, the tendons, lead to decrease in tendonitis or tendinopathy. Injections, I talked about earlier how if this isn't tendonitis and it's tendinopathy or tendinosis, it's not going to make it better. And in fact, it can make it worse. So we want to really make sure we know it's tendinitis before we get these injections. And the key with tendinitis is itis 0 to 6 weeks in length. Then you have subacute injuries, which are 6 to 12 weeks in length. And then you have chronic injuries, which are over 3 months in length. So if you've had a chronic injury, it's most likely not tendinitis. It's probably tendinopathy. So these steroid injections might not be beneficial. Just keep that in mind. PRP, plasma rich protein. Several studies comparing PRP with corticosteroids and long-term effects have shown that PRP is more beneficial in the long term than corticosteroids. However, when compared to a saline injection, PRP did not. This is definitely the new line of thought: is these stem cell research and plasma-rich protein research. This regenerative medicine is really going to be our future. It's just gonna the studies are gonna come along in years to come. And said the problem, inflammation actually might be the problem. This way, you're having a lack of inflammation causing a failed healing response. So if you're further stopping your inflammation, um, that's a problem. It's going to lead to a failed healing response. It's not what we want. You could be in it for a couple of weeks because of the degenerative nature of most tendinopathies. It takes several weeks to months for healing to occur. Be ready to activity. Um, that kind of puts your expectations in check. Don't think you can get rid of this in a week. You want to have the expectations that it's going to take a couple months to get this better. Even with proper treatment, there may be some residual weakness and thickening of the tendon, but full functionality can usually be restored. A lot of people become frustrated by the length of time for treatments needed to improve their symptoms. As a result, a lot of patients return too soon to their activities, and they don't reach that final stage of healing, and they re-aggravate it, and it becomes worse than before. So patience is key. Moral of the story: don't do nothing. Like we said, rest doesn't mean doing nothing. You want to manage your condition and manage the loading on your tendons because it's the most effective means of treatments for the lower and upper extremity tendinopathy. So now we have some decisions to make, and decisions are always tricky because you never want to make the wrong decision. That's what this video is for. Please put any comment sections below too with any questions. This video we watch it later or suggest it to a friend, but it's all about making a decision. If you feel like this might be you, you might have tendonitis, tendinopathy, you have some kind of overuse injury, or you've been diagnosed with an MRI that you have tendonitis. Uh, Definitely watch this video. Then you have a decision to make what you want to do about it. You can try some of the tips that we suggested, but if that doesn't work, I would definitely encourage to come into the clinic for an evaluation. It's very thorough. We get to meet you. We do an hour-long assessment. We figure out not only what is injured, but what caused it in the first place for the ultimate solution to relieve your pain and make sure it doesn't come back. Um, if you are not comfortable with coming into an evaluation, there's a telehealth evaluation you can you can set up. It's more of a consultation. We don't do anything physically. We can't touch you because it's going to be through a webcam. But please contact our office first and ask questions if your insurance will cover your evaluation, whether it's telehealth or an in-person evaluation. We also have self-pay options as well. And the third option, a decision you can make, is just start, like I said, start with education and exercises that we already described in this video. Give them a try, see if they work for you. And, like we said, you have to be patient, give us some time. But if it's not working with you, definitely contact us with our email here, info@Premier PT. I think it's supposed to have a second T in it, pttjax.com. Call us. Our number is linked to this video below. You can call us and ask us if you think you can speak to a therapist on the phone and ask if you think you should come in for your evaluation or what you should do about your injury. And that pretty much wraps up this webinar. So I'm going to look to see if there's any comments here. I don't see any comments. I will refresh this. But like I talked about also, this is going to go to YouTube, and you can comment on our YouTube page in the comments section, and we can answer your comments there. So that wraps everything up. Thank you for joining, and the important thing is we want to get out there and keep moving, keep active, and we're hoping we could be a solution for you. No comment section. Okay. All right. Have a good day. Thanks, y'all. All right. All right. I think I got it.